What we thought would be useful, just to make the point, was to show you what we saw happening to one patient on a ward when one of our researchers was watching a person administer their medicines. And what they did, they got all the tablets the person was taking and put them in a pestle and mortar. They then emptied the capsules in. And then once they'd done that, they just crushed everything up together with a pestle and mortar like this. So you ended up with a nice colourful sludge at the bottom of the dish. Once they've done that, and you can see it's not that easy, it takes a while to do. And for someone like myself who spent years learning about how we make tablets and how we design them, it's very upsetting to see. A lot of thought has gone into these tablets, a lot of thought's gone into their design, and seeing someone then just mash them up into a fine pulp and crush it, somewhat upsetting, and I lost a bit there. But then what they did was add some water to it to make it into a nice palatable sludge. And once they'd done that, they then fed that to the patient. How would you feel about being given those medicines? And what do you think that tastes like? And the point I'm making here is very often we prescribe medicines for a patient and we just put normal tablets and capsules down and we don't think about the person administering it. And I believe the person who was administering the medicine was trying to do the best by the patient. They were told that's what they had to do, they were told they had to get the medicine into the patient, and therefore in their mind the best way to do that was to do this. Crush them up, add some water, and then feed the patient. And what shocked us was we saw patients actually being sick or looking as if they want to be sick whilst they were taking these medicines. So what we need to do is think about alternative approaches, different ways of giving the medicines. First choice is something like Adcal. Very nice, chewable. That may be a simple way around. These are designed to be crushed, to be honest with you, because they're crushed by the mouth. And what's nice about them is, if you can see that, they're fruit flavoured, so actually they're palatable. Far better flavoured than what we had in that pestle and mortar. The next thing I want to show you is what's designed for patients who can't swallow. Things like soluble prednisolone and soluble paracetamol. What we have to watch out for though, particularly with effervescent tablets, is to have a lot of sodium in them. So if our patient has a sodium restricted diet, we have to think carefully before we actually start adding water and giving large amounts of these to our patient. But you will see straight away when I pour one of these tablets in to the water how it dissolves straight away. It is designed to be administered in that way. So that's the obvious alternatives to use soluble tablets or to use chewable tablets. What we're very often faced with are tablets and capsules, but there are certain shapes which we know patients prefer. So anything oblong and round, patients prefer to swallow these things that are round. So very often you can say, is there a different shaped tablet we could use which is easier to swallow? One thing I want to say though is that there are certain tablets such as Nicorandil which have nothing on to warn you that they're not safe to crush. There's nothing in the name at all. But actually when you look at the blister pack, there's something going on strange there which tells you these may not be appropriate to crush. What's happening here is we have a large tablet which you do not give to the patient. This is what's called a desiccant. And what I mean by desiccant is something that draws the moisture out of the air. So that there is to make sure the tablets stay dry. And so there's you'll see a little system to each of those tablets which is continually drawing the water out. So that there's no warning with these tablets probably are not the best ones to pop out and put in and crush up and add water to, because I'm guessing that may break them down rather quickly. And this is again why you need to ask the pharmacists. When you see anything like this, you start thinking, why is that? And why do we have this extra tablet in there? The next point I want to make is about modified release tablets. So this is a good example of a tablet that's modified release, designed to be taken once a day. And when you open that up and look at the tablet, you will see there's nothing that gives away, in this case, the fact that it's modified release. It is just a bland white tablet. So the first thing to say is, by looking at the tablet, you may not be able to tell that it's modified release. It does give it away here on the name. It says XL. If you buy the branded version of this one, which we didn't bring in, actually you can see different layers in the tablet, and those different layers might give you some idea that there's something going on and there's different ways the drug's being released in each layer. But in this case, just looking at the tablet, you would not know it was modified release, and it's only when you read the label that you can see that. Now let's move on to capsules. I have two capsules here, two different drugs, and by looking at them, can you tell which one's modified release? And the answer is you can't. There is nothing that gives away the modified release nature of this one. So this one has special granules in, this one doesn't. Again, if we look at the names, however, on the boxes, this one actually says modified release hard capsule. So again, you can see it very often highlighted on the packaging, but it isn't seen in the capsule. I have another capsule, however, which does make it very clear. If you look at this one, and I'll pop it out and see whether we can show it a bit more clearly, you will see there are little granules in there. So there's little granules of different size, and it's the size of those granules and the encapsulation of those granules which modifies the way the drug is released from that capsule. So this is a capsule which you should not open and crush, because immediately you do that, the patient gets the full dose. And the full dose of a beta blocker released immediately is likely to make them dizzy at the very least, and possibly make them dizzy when they stand up and drop their blood pressure very quickly. Next one I'll show you is a gastro-resistant capsule. And this capsule, again, you can't tell really by looking at the capsule itself. It's just a white capsule. But again, you see on the label the term gastro-resistant, and that itself will give you the clue this is something you shouldn't be opening up and shouldn't be crushing. Another alternative to that one, which is gastro-resistant, is the oral dispersible version of lansoprazole. What that means is you can disperse it in the mouth with water. So we open it up, add water to that in the mouth, and that will then break up into small granules. So again, with this one, because it's all dispersible, that doesn't mean you can crush it. You can let it disperse in water, but you can't crush it, because as soon as you crush it, you break it up into you break up the granules as well and change the way it's released in the body and get rid of the enteric coating that's on there to protect it. The last thing I wanted to show you was these tablets which are film coated and these tablets which are sugar coated. This is meptazanol, and this tablet here I broke in half and I just put on my tongue just to see what it tastes like, and it's incredibly bitter. So again, this one, if you'd crushed that and handed that to the sludge, would have been really unpleasant for the patient to take. Similarly, ibuprofen has either, in this case, a sugar coating, and that coating there again is to hide the flavour of the drug inside. So when you've got something which has a film coating or a sugar coating, you do need to think carefully about what does this mean for the patient and what's it going to taste like if I decide to crush it for them. Occasionally you'll ring up your local medicine information service and they'll say disintegrate the tablet. So it's not something that's designed to be soluble, but equally it's not got a special coating on it. And what they say you should do is take the tablet, put it in some water and just let it disintegrate. And it might take 5 minutes, it might take 15 or 20 minutes. But they will give you that advice at the same time, and they'll say to you very often, that's a safe thing to do. One thing I would say counter to that, as our experience was, if you tell people to disintegrate tablets and leave them, they do that, but then they forget to come back to them. And there was numerous occasions when we were watching staff on the ward where actually staff would leave the tablets to disintegrate as directed, but then completely forget because they'd done another 5 patients before this patient had disintegrated, and they'd forgotten to go back and give the medicines. If you're given this advice, then by medicine information, then they've obviously decided that's appropriate and safe. And what we've done is put an information leaflet on the MOOC which you can look at, which explains how best to do this for your patients or for yourself.